Hi, I'm Cody Sandusky, President of the Illinois Pharmacists Association. As a healthcare professional, I often describe the last year as being simultaneously the longest and the fastest year I've ever experienced. It's almost like a decade compressed down to 12 excruciating months. Despite the overwhelming uncertainties, one thing is very clear. The health and well-being of millions of Illinoisans has relied tremendously on the unwavering dedication of our brave healthcare heroes to navigate the storm that is COVID-19. Among those many heroes are thousands of pharmacists across our state who have gone above and beyond to care for their patients and their communities. In particular, our independent community pharmacies, many of which are in our state's most underserved areas, have stood tall as pillars of their communities, providing access to much-needed prescription medications, accessible health information, COVID testing, and now vaccines. Sadly, these once thriving businesses are struggling to survive. You see, our independent pharmacies are fighting two battlefronts right now, one against a global pandemic and the other against pharmacy benefits managers, PBMs. For those unfamiliar, PBMs are intermediary firms that manage prescription drug benefits for health insurers, Medicare Part D plans, and large employers. On one end, they contract with insurers and insurance plans to process patients' prescription drug claims, and on the other, they contract with pharmacies to reimburse them for the cost of purchasing drugs and dispensing prescriptions. In recent years, PBMs have leveraged their market power to implement abusive policies and Byzantine practices that line PBM pocketbooks at the direct expense of health plans, pharmacies, and patients. These practices are driving many pharmacies out of business and jeopardizing patient access to essential care, which is an even greater threat in the wake of the COVID-19 pandemic. More so, PBMs are bilking taxpayers out of hundreds of millions of dollars, as evidenced by reports from New York, Florida, Ohio, and Pennsylvania. The predatory threat of PBMs long predates the COVID-19 crisis. However, this past year has greatly exacerbated the situation, leaving many independent pharmacies at their breaking points. These greedy companies routinely top the Fortune 500 list with ever-increasing profits. For instance, CVS Health, the parent company of CVS Caremark, reported total revenues increased in 2020 by over $11 billion. Perhaps what's most frightening is these companies do it all with little to no oversight. They're currently able to practically run wild without anyone to stop them. There is hope, though. In December, the Supreme Court issued a unanimous decision in Rutledge versus PCMA, the lobbying arm of the PBM industry, which removed obstacles for states to enact their own PBM regulation. Pharmacy advocates in nearly every state in the country, including Illinois, have seized this opportunity to introduce legislation geared towards reining in the abusive and unethical practices of PBMs. A bipartisan bill in Illinois, Senate Bill 2008, has been introduced to help correct the imbalance of PBM's power and incorporates patient access and reimbursement regulations upheld by Rutledge versus PCMA. This bill not only has the full support of the Illinois Pharmacists Association, but also several civic and labor leaders and other healthcare advocacy groups, including the Illinois State Medical Society. PBMs are parasites and a scourge on the face of our healthcare system that must immediately be brought under control. The ball is now in the General Assembly's court. Patients deserve better access to care, small businesses deserve a level playing field, and taxpayers deserve accountability. Illinoisans deserve a yes to Senate Bill 2008. So I highly encourage you, please contact your senator and ask them to either co-sponsor or vote yes for Senate Bill 2008. As always, thank you for everything you do for your patients, your communities, and our professions. Good night, and God bless.